Good wishes to everyone. This is Group 7 and we are here to show about general survey and history taking, vital signs, different tests for ears and different tests for eyes. The learning objectives for mastering the examinations are to identify and examine, sharpen skills for assessing and describing the patient's general appearance, to be familiar with the techniques of examination, accurately assess visual acuity, extraocular movements, pupillary reactions, and auditory acuity. Patient's general survey and health history. With the patient's health history and mind, now you are ready for the examination.
Good morning.
Good morning, doctor.
Have your seat.
Thank you.
Myself, I'm a medical practitioner. Your name, please.
My name is Virendra, doctor.
Okay. How can I call you?
You can call me Viru, doctor.
Okay, fine. I need to take history, which will involve me asking you the questions about health and social circles. Is that okay with you?
Yes, it's fine, doctor.
Okay. Before we start, I just wanted to confirm with your details. Your
Yeah.
name, Virendra.
Yeah.
Age
During
20.
examination, observe patient's face, noting facial expressions, contours, asymmetry, involuntary movements, edema, and masses.
Is this your address?
Yeah, that's my address, doctor.
Okay, perfect. How can I help you? What is your problem?
Actually, doctor, I have severe cough past 4 days, doctor.
Is your throat is paining when you're coughing?
When the cough is severe, it's paining.
How long is the cough?
Since last Thursday, doctor.
Okay. Is it dry or mucus?
It is dry, doctor. Not
Okay, fine.
mucus.
Is there any chest pain?
Yeah, when I'm coughing more severely, then the whole chest is paining, doctor.
Okay. Do you have any another symptoms like runny nose?
No, doctor.
No. Okay, like allergies, sneezing, irritation of throat.
Irritation is there, doctor.
Okay.
Doctor, even I felt nauseous sometimes.
Okay. Is it blood vomiting?
No blood vomiting.
Okay, fine. What are the places affect the symptoms? Like home, office, or something like the desk, heat, anything?
If I go outside, there is so much of dust,
Okay.
and even in my office,
Okay.
yeah,
Fine.
it's more in the morning, doctor.
Okay. Is it worse any particular time during night, daytime?
Yeah, it's actually in the morning, more in the morning.
Does anything does anything matter like better it's worse sometimes like in which will you fear like better in your relatives? Asthma, tuberculosis, emphysema.
Actually, my grandmother is having asthma.
Okay, fine. What is your occupation?
I have a job
Okay. Where do you live?
near Alabama.
Is it your surroundings is good?
Actually, where I live is good, doctor, but my working place is a little dusty.
What are your leisure activities?
Um, I do gym and sports.
Okay, fine. Thank you.
Thank you.
Come in, please. Doctor. Review system of the physical examination from head to toe should be in a documentation form for the review.
Okay, take your seat.
Thank you.
Okay, myself, Dr. Raja, and what's your name?
Viru, doctor. I'm Viru.
Good. By the way, yeah, you're having like cough, right? Your case was cough, right? Dry cough.
Yeah, dry cough, doctor.
Yeah. And you said that you have pain. in chest
Yeah,
while
when I'm
talking.
severely coughing, it's paining all over here. And sometimes even the chest area, if it is
Okay.
severe.
In the scale of 1 to 10, can I know what is your pain?
Maybe 8.
8. Oh. Okay. Then my nurse will assist you.
Yeah.
You just go with her.
Okay, doctor.
By recording the height and weight of the patient, we can estimate the BMI of the patient. Stand over here.
Thank you. Yeah, take a seat. Yeah, we will
Yes, doctor.
feel free, okay?
Yeah,
You know how you're feeling?
I'm feeling good, doctor.
Okay. And just it will take a while.
Yeah.
We'll finish all the tests only.
Yeah,
Now I'm gonna take the temperature for you.
sure, doctor.
Memo. Yeah, okay. Then we will what are you doing?
I work in Alabama, doctor.
Bang, what job?
Engineering. I'm a software engineer.
Good. Then you're married?
No, I'm senior doctor.
Trying for a girlfriend?
No.
No? Okay. Anyway, then. Okay. Come here. Okay, Viru, I'm gonna check your pulse now.
Yeah, sure, doctor.
Yeah.
The radial pulse is most often used to assess the heart rate. Count the pulsation for 60 seconds or count for 30 seconds and multiply by 2. Average resting pulse rate in adults is 70 beats per minute.
Okay. Now, Viru, let me check your heart rate. Huh?
Yeah.
Slowly inhale and exhale.
Assess the respiratory rate by inspecting the rise and fall of the chest. A good way to do this is to count the respiration just after counting the pulse while you are still palpating the radial artery.
Can you
The
tell?
expected adult resting respiratory rate is 12 to 20 breaths per minute.
Yeah, okay. Yeah, now you'll be taking your blood pressure.
Yeah, sure,
And
doctor.
also will take.
Ask the patient to sit quietly for at least 5 minutes in a chair with the feet on the floor rather than on the examining table. Excuse me, did you have any coffee or did you smoke before coming here?
No, I don't.
Okay. Can you please roll up your sleeves?
Oh, it's tight. Are you wearing half sleeves?
Yeah, I'm wearing half
Oh,
sleeves.
can you remove your shirt then?
Yeah, sure.
Thank you. Pass.
Break for 30 seconds, then we will continue again.
You're feeling free, right?
Yeah.
Okay, then, yeah, it's the final test. Then you'll be going.
Yeah, sure, doctor.
Seconds, right? Yeah, you can check it.
Place the bell of a stethoscope lightly over
Yeah.
a brachial artery, taking care to make an air seal with its full rim. Inflate the cuff rapidly, again to the level just determined, and then deflate it slowly at the rate of about 2 to 3 mm Hg per second. Note the level at which you hear the sounds of at least 2 consecutive beats. This is the systolic pressure. Continue to lower the pressure slowly until the sounds become muffled and then disappear. The disappearance point, which is usually only a few mmHg below the muffling point, provides the best estimate of true diastolic pressure in adults. Eye assessment. Begin the eye examination by assessing the patient's visual acuity. Help the patient to be 20 feet far from the Snellen chart. Patients with glasses or lens should remove them. Patients with reading glasses should be removed. If not, the vision acuity may be blurred. Ask the patient to cover one eye and read the smallest line print as possible. The smallest row that can be read accurately indicates the visual acuity in that eye. Visual acuity is expressed as two numbers. 20 the numerator 20 denotes the distance of the patient to the chart, and the denominator 20 denotes the distance at which the normal eye can read the line of letters. The larger the second number, the worse the vision. Pinhole test is to see if the observed decrease in acuity was caused by the refractive error. Ask the patient to hold a pinhole occluder or a piece of paper with a small hole in it over an uncovered eye. This maneuver permits a light to enter only the central portion of the lens. Expect an improvement in visual acuity by at least one line on the chart if refractive error is responsible for the diminished acuity. For screening purposes, visual fields are tested by confrontations. Two tests are recommended for knowing the anterior and posterior visual pathway. Static finger wiggle test. Two index fingers were presented simultaneously, lateral to the patient's ear, about 2 feet apart. Wiggle both fingers simultaneously and bring them slowly forward and curving inward towards the center. Ask the patient to tell you as soon as he or she sees the moving finger. Map out the extent of the left and right visual field. If you find a defect, try to establish boundaries. Kinetic red target test. Facing the patient, move a 5 mm red topped pin. Here we used red topped pencil. Invert from beyond the boundaries of each quadrant along the line bisecting the horizontal and vertical meridians. Ask the patient when the pin was first appeared to be red. Lacrimal apparatus. Briefly inspect the regions of lacrimal gland and lacrimal sac for swelling. Conjunctiva and sclera. Ask the patient to look up as you depress both lower lids with your thumbs, exposing the sclera and conjunctiva. Inspect the sclera and palpebral conjunctiva for color and note the vascular pattern against the white scleral background. Look for any nodules or swelling. Extraocular movements. To test the 6 extraocular movements, ask the patient to follow your finger or pencil as you sweep through the 6 cardinal directions of gaze, making a wide H in the air. Cornea and lens. Examine the cornea for clarity by shining a light tangentially on it. Pupillary reaction to the light. Direct reaction, pupillary constriction in the same eye. Consensual reaction and pupillary constriction in the opposite eye. Ophthalmoscopic examination. Darken the room. Place the ophthalmoscope to 0 diopters and the large round beam. Keep the index finger on lens disc. Use right hand for patient's right eye and left hand for patient's left eye. Ask the patient to fix gaze on a spot on the wall. From about 15 inches away, about 15-degree lateral look into patient's eye. Observe the red reflex and then move in closer. You may rest your opposite hand on patient's forehead above the eye to help guide. Ear examination.
The auricle. Inspect the auricle and surrounding tissue for deformities, lumps, or skin lesions. If ear pain, discharge, or inflammation is present, move the auricle up and down, press the tragus, and press firmly just behind the ear. Holding the otoscope handle between your thumb and fingers. Brace your hand against the patient's face. Before inspecting the ear, pull the ear up and backward and insert the speculum gently into the ear canal, directing it somewhat down and forward and through the hairs, if any. Inspect the ear canal, noting any discharge, foreign bodies, redness of the skin or swelling. Inspect the eardrum, noting its color and contour. The cone of light, usually easy to see, helps to orient you. Identify the handle of malleus, noting its position, and inspect the short process of the malleus. To begin screening, ask the patient, do you feel you have a hearing loss or difficulty hearing? If the patient reports hearing loss, proceed to the whispered voice test. The whispered voice test is a reliable screening test for the hearing loss if examiners use a standard method of testing and exhales before whispering. Exhale a full breath before whispering to ensure a quiet voice. Stand 2 feet behind the seated patient so the patient cannot read your lips. Occlude the non-test ear with the finger and gently rub the tragus in a circular motion to prevent transfer of sound to the non-test ear. Whisper a combination of 3 numbers and letters such as 3U1. Use a different number letter combination for the other ear. Testing for conductive versus neurosensory hearing loss. Tuning fork tests. For patients failing the whispered voice test, tuning fork test may help determine if the hearing loss is conductive or neurosensory hearing loss. Test for lateralization. Weber's test. Place the base of the lightly vibrating tuning fork firmly on the top of the patient's head or on the mid-forehead. Ask where the patient hears the sound, on one side or both sides. Normally, the vibration is heard in the midline or equally in both ears. Compare air conduction and bone conduction. Rene test. Place the base of the lightly vibrating tuning fork on the mastoid bone, behind the ear and level with the canal. When the patient can no longer hear the sound, Quickly place the fork close to the ear canal and ascertain whether the sound can be heard again.